Thank you so much, everyone, for being able to join us today. And on behalf of Barnett, we thank you for choosing Barnett as well. My name is Trina Jackson, and today's topic will be strategies for conducting vendor audits. I have about 15 years, well, a little over 15 years of experience conducting vendor audits globally. I've been a consultant and an adjunct professor for pharmaceutical compliance and quality assurance, and also clinical research. So I hope to be able to answer hopefully most of your questions on today, and I hope that this will be as interactive as possible. So let's go ahead and get started. So the learning objectives for today include describing the various types of vendors that may be audited, to discuss the types of vendor audits, implement processes that can be used for selection, audit, approval, and qualification of vendors based on the material, equipment, or service that is being delivered. We will explore methods and tools that can be used to accomplish a vendor audit, and we will discuss the importance of and methods for following up to vendor audits. So let's start off first with looking at what is a vendor. Certainly we have some definitions here that can be used to define what a vendor is, including an independent business that is contracted to carry out specific delegated tasks and responsibilities by a said sponsor or company who is subcontracting with them. There are many different names that you will hear when it comes to the word vendor. Those may include subcontractors, contractors, CROs. Different companies refer to them using different names. For the purpose of today's conversation, we will use the term vendor, however, but it's all talking about the same type of company or role that that particular business is playing. Vendors will often offer a wide range of outsourced research services to support the research and development process. They may range from your large international full-service organizations, which a lot of CROs are today, and even some other types of companies, including some of the companies that offer more so like IT services, or let's say, for instance, interactive voice response services. A lot of those offer international services. So some of the more small specialty groups that may offer a tablet for a particular type of study, the more niche type of companies that may offer those particular services. So there's definitely a full range. They usually support the drug development process from conception to marketing approval, bench to shelf, and beyond. I do want to point out that when we talk about vendors or subcontractors, that these are not the same as what we would commonly refer to as a consultant. When we talk about consultants, and the way that I have handled those in the past is that for consultants we usually use a different process, where rather than going through the whole audit process, because as you know, with a consultant, a lot of times it's a single person, usually working from their home. There's no place to really go to audit. They don't usually have full range of SOPs and all those types of things as most vendors would have. So in those cases, how we handle that is we would collect the CV of that person and any licenses that may be applicable to the services that they're providing, a copy of that, and we would ensure that training records are maintained for that person. So that is one way that you can manage the consultants in addition to the vendors that you would have, and kind of separate that distinction of the two, but still making sure that you have oversight regarding their qualifications and their responsibilities that they have. When it comes to vendors, the likelihood of inspection is variable, but it can occur. Traditional CROs and other service providers tend to be inspected more frequently, but we want to make sure that we are still providing that oversight. So continuing to look at what is a vendor, also want to give the reference to the Compliance Program Guidance Manual that is listed here, and this refers to sponsors, monitors, and CROs. You can see that here. For the CRO, it talks about entities such as organizations or corporations that have entered into a contractual agreement with a sponsor. And also wanted to note that this may also be in accordance with 21 CFR 312.52 and 511.1 regarding responsibilities, and how the responsibility as well as authority may be transferred, and thus the CRO becomes a regulated entity.